thank you for having me today. Dr. Peterson came and snuck up behind me. I didn't even see her there until they brought her up, but and I don't know if you recognize the face, but I'd worked with Community Dental Clinic out of dental school. And so she's kind of an inspiration of the public health side of what I've done, and so it's awesome to see you here today. Congratulations. So Nancy asked us to talk about our clinic a couple months ago, and our clinic opened up, our first clinical day was September 11th of this year. We haven't even had 50 clinic days. We're open Monday, Wednesday, Friday. And when the idea came up to come talk about what we're doing, I kind of said, well, we don't even know what we're doing yet. We don't know what we're doing. And it's just like the blind leading the blind, but I said, well, maybe by then, maybe we'll have kind of a little more firm grasp on what we're doing. So I was looking at myself this morning in the mirror. I'm like, why am I nervous? Why am I so nervous? I've never done anything like this before. And I'm not nervous to speak in front of people. That doesn't bother me. I love people. I thought, the message we're trying to get across is just to educate on what we're doing. And I thought, gosh, maybe they'll notice my belt. I'm wearing a really ugly belt, but it's my lucky belt. It's a pretty beat up belt, but I wore this belt when I proposed to my wife when I went to my dental school interview. I thought, I'm gonna wear my lucky belt today. It doesn't even really match. It doesn't even really match what I'm wearing. And I thought, no, that's not why I'm nervous. And I guess what I'm most nervous about is I don't want to put you guys to sleep. I want you guys to enjoy the next 50 minutes. So if you have questions, ask. If I tell a joke, laugh, please. If it's a bad one, laugh really hard to make up for the person next to you. But we'll tell you a little bit about today about what we're doing and how we're growing. And like I said, we're a pretty new clinic. We're 2.5 months into what we're trying to accomplish, and I think we got a long way to go, but we got a good team to get there. So I think I'm pointing at the right spot here. Do you want to just hit the space bar maybe? This isn't working. So who are we? That's Bill and his wife Anna. Bill Heitzman's in the room. A lot of you guys I think might know Bill. Bill's an advanced dental therapist. I didn't have any picture of Bill's kids. He's got 2 great kids, but I didn't have a good picture of that. This is my family on the bottom right. That's the whole world to me. That's why we do what we do. But Bill and I knew each other in college, actually, at University of Minnesota Duluth. We played lacrosse together in college and got to be pretty good friends. And about I don't even know how many years later, out of school, I ran into Bill at Southdale Hospital. I was having a kid that day, and so like your head's not normal when you're having kids. I think I was having my second child, or my wife was anyway. And I ran into Bill in the elevator at Fairview Southdale Hospital. I'm like, what are you doing here, Bill? He's like, I'm volunteering. I'm like, why? What do you mean? Like, what do you mean volunteering? Tell me what you're doing. He's like, well, I'm thinking about this advanced dental therapy stuff. And I'd heard something about it. I was at the University of Minnesota Dental School when that program was just kind of taking off. I graduated in 2008. And you get so involved in your own stuff, you don't stop and kind of look at everything. And I thought, gosh, that's interesting. So he and I kind of connected a little bit as we talked about it as the application process, and he had some frustrations because he was one of the first couple classes to come out, and it seemed like there was this all direction to get a program together, and then when they got out, what do you do? Where do you go? Where do you work? How do we put these people to work? How do we utilize the skills that we're teaching them? And just kind of following up with the program, I noticed, things have changed, and now they have a dual track system with hygiene and dental therapy, which I think is brilliant. And I understand that systems are evolving and things get added and made better as things go, but it's just, I never really thought much about it. And then Bill and I kind of connected, and I think, I'm a big believer. I think things happen for a reason. Raise your hand if you think things happen for a reason. Okay, whoever didn't raise your hand, you're wrong. There's too many things out there that prove it to me that things happen for a reason. But anyway, so Bill and I connected in the hospital, and then That was years back, okay? If you want to go to the next one there. I did my PowerPoint on an Apple computer, and apparently my logos on the top and bottom didn't come through the same, but so who am I really? When I graduated from dental school, my wife and I also met at UMD, and we wanted to go back to Duluth to practice and live, and I thought that'd be great. And then about a month before, we actually had to make some serious decisions. She said, "No, I can't go to Duluth. I can't be away from my family." I'm thinking, oh, well, now what am I going to do for a job? I had a job lined up in Duluth. We had looked at a house. I'm thinking, okay, things happen for a reason. I'll start looking, and I found community dental care. And actually, my dad grew up a block down the road from the one that's on Arcade in Maryland. My grandma still lives there to this day. So I knew the neighborhood pretty well, and I thought, well, this will be an opportunity to get busy and use my skills. It was probably one of the best things that ever happened to me clinically, unintentionally. You know, my idea was to join a private practice in Duluth, and now I'm working at community dental care. And on my first day, Dr. Nguyen, is she still with you? Okay, God bless her. She's amazing. She was my mentor. My first day, okay, I learned 3 things. First of all, public dental health is an athletic activity. I'm not kidding you. I'd go home sweating, and we'd be, 3 columns, you're running, you're going, okay, what's this, what's that? I mean, it was fantastic, but it is exhausting, but in a good way. And the first day, we had a patient that needed some wisdom teeth extracted. And they weren't too tough of wisdom teeth, but I had never taken out a wisdom tooth before. At the University of Minnesota, the way the rotations work, you just get assigned the tooth to extract that they give you. It could be number 5, number 4, number 2. You just take out 1 tooth, and gosh, you feel like you just saved somebody's life. You took out 1 tooth. Oh my gosh. Then you get to the real world, and this guy needs his wisdom teeth out, and Dr. Nguyen was there. She gave me the best piece of advice, and I never forget this. And I was kind of nervous, kind of like I am right now. And she said, "Okay, you know what not to do, right?" I said, "Yeah." She says, "Just don't do that." Okay. She goes, "Call me if you need me. I'll come find me if you need me." And I ended up wiggling out 3 of the 4. And this number 32 was just, I could get it moving, I couldn't get it out, and I'm like, my gosh, I'm so close, and I'm running behind, so I went and grabbed her. I said, "Hey, I need help here. I want to make sure I get this out." She comes over with the elevator and just like pops it right out. I'm like, are you kidding me? But that gave me an incredible amount of confidence, and the experience that we got there. Back then, molar endo was a covered service through the state programs. I do all my own molar endo now because it was a mini endo residency. You get to do molar endo. You get to do a lot of the experience I got in that year was unbelievable. And I think every dentist should have to have an experience like that. It's unbelievable. But also one other clinical thing is that I remember I saved that tough wisdom tooth for last. I don't do that anymore. I always start with the tough one. Always. I don't tell the patients that until we're done. I always get the first one done. I'm like, "God, you're doing a good job. The worst one's done." They love that. They love to hear that. The worst one's out of the way. So, who am I really? I private practice 90% of my time. I have two practices, one in Shakopee called River Rock Dental and one in Waseca called Waseca Family Dentistry. I love dentistry. I love the business side of dentistry. I'd probably work 90 hours a week if I could, but my wife would kill me. I love what I do. But there's an opportunity to do something beyond just private practice, and as the opportunity presented itself, that's kind of how we evolve into where we're at today. You want to hit the space? So how did it all begin? I think our specific clinic is a product of our situation, okay? I'll tell you what I mean by that. In Shakopee, there's 2 brothers, Al and Jim Perry. They both are recently retired dentists. And their dad built them a building, and they worked together for a while, and then all of a sudden they got big enough and they said, well, we're going to split and we're going to be on opposite ends of the building. You don't see too many strip malls with 2 dentists in the same building because it's a competitive nightmare. You wouldn't want to rent next to another guy. Who knows? You call somebody and then you get them do all that work to do the marketing. You get them the new patient in the parking lot, and all of a sudden they walk into the wrong door. You just lost them. It's kind of funny how they split up and whatever. But essentially, I bought the practice on the left side of the building in 2013, and then I bought his brother out April of this year. And we took all those patients and we moved them into the one practice. And now we have a 5-unit clinic that's got nothing going on, nothing to do. It's just sitting there. It was fully operational the day before. Now it's sitting there, and you guys know how expensive it is to plumb out a dental office. I mean, it's incredible. I thought to myself, what a waste if we just knock it down and throw an insurance agency in there, put a, whatever. I mean, we got a resource here. Let's think about ideas to do it. And, sorry, one sec here. I thought about putting in a dental implant center where we place nothing but implants and kind of doing a clear choice kind of thing. And I do place a lot of dental implants, but I thought, gosh, how's that gonna? I didn't think that was gonna work. I thought, gosh, could we bring a specialist in? Could we endoscopy? Could we use a periodontist? Could we use an endodontist? Yeah, I talked to some people, and I couldn't find anybody interested in this space. And then I was laying in bed one night, looking at the ceiling, and I remember a conversation my grandpa and my dad were having, and this is my mom's dad. This is my dad's father-in-law, and my dad was kind of contemplating retirement, and he's healthy and he could keep working if he wants, and he's kind of asked. He said, "Maynard, what do you think? What do you think I should do?" And the line he said was, "Just remember, the more you have, the more you want." That line just kind of stuck with me. And my grandpa passed away last year, and he's kind of one of those salt-of-the-earth guys, but the more you have, the more you want kind of stuck with me. And I was thinking, gosh, how many times do we sit in the clinic and we get calls from people on state programs and we got to refer them to the open door clinic. We got to refer them somewhere that they got to sit on a waiting list for 6 months. We'll get, between the two practices, we'll get 25, 30 calls a week. I'm thinking, gosh, we have an opportunity to create a resource in the community, okay? But I'm practicing 40 hours a week. How do I make this work? How do we turn this into a resource? And then I thought to myself, gosh, Bill Heitzman. Bill Heitzman, I gotta call Bill. I gotta figure out, I gotta learn more about this dental therapist idea. How can we make this work? How can we make something out of something less? So I called Bill. And again, I think things happen for a reason. I called Bill and I asked Bill, tell me what's going on. He's up in Grand Marais. I mean, it doesn't get any farther north than that. He's up in Grand Marais. I didn't even know where Bill was at the time. We had just kind of lost connection with the young families and everything. And I said, well, what's going on up there? Oh, I'm doing dental therapy and this and that. And I said, interesting. I said, well, I'm running an idea past you. And I'm, not knowing what Bill's schedule was or how things worked out with him, but I said, I'm thinking about opening up a clinic that's going to be run by a dental therapist, and that we kind of refer to a dentist within the clinic. And I could hear Bill getting interested in talking about it. And we kind of had a few phone conversations, and then I guess my next conversation was like, do you know anybody? What's your situation? Would you be interested in coming back to the Twin Cities to help me kick this thing off the ground? And it worked out. The timing was kind of unbelievable, and the situation Bill was in their clinic and taking on a new dentist and everything else. And I give Bill a ton of credit because he took a pretty big leap of faith, moving his family and his kids and things like that. But that's when the hard work became the commitment to making it work. I have a commitment to Bill to making this work, and Bill has put a huge commitment into this clinic to getting it where it is right now. So if there's anybody that needs to be recognized at this point, it's Bill Heitzman for what he's done to get us to where we are right now. It's a huge deal. Are there any other dental therapists in the room? Stand up if you're a dental therapist. We got 1, 2, 3. Fantastic. So as you guys know, the clinical side of dentistry is challenging, and it can be challenging, but I think it becomes the easier part as time goes on. After you've done something so many times, then it becomes, how do we do it better? How do we do it? How do we make this clinic better? How do we make our team better? How do we do more procedures? How can we do more for these people? Bill's taken on a clinic and started it from scratch. So if you want to go to the next slide, please. What about running a business? Okay, this is a business as far as, we're not a nonprofit, and not because we don't want to be, and not because it's all about making money, but because I didn't know where else to start. I just wanted to get something started. We wanted to start treating patients, and to set up a nonprofit, I looked at some of the board stuff and the organizational stuff, and I thought, my God, it'll be a week and a half before I can even work on this other stuff. So I said, let's just get it started. Let's start up an LLC and let's get it going. And I think Bill's run a lot with that, and he understands more about running a dental practice than many dentists out there. Okay? There's a lot of dentists that come to work, they show up, they do dentistry, and they go home, and there's nothing wrong with that. The business side of dentistry between private practice and public health is extremely different. The margins and the percentages and your values and your variables, where you got to be successful. How successful do you want to be? In private practice, those numbers are pretty rigid, and you can say, I want to fall within this category and make it work. Public health is a totally different beast. The reimbursement rates, you don't know what services are covered. Trying to explain to people, yeah, I know your molar hurts, but you got to have it pulled out because they won't cover a root canal unless you can cover it. How do we work with the reduced fee schedule? How do we get a team put together? You know, the many hats. You wear a ton of hats as the business owner before you even put your hand on a handpiece and touch a tooth. So I threw a ton of stuff at Bill. A ton of stuff. Probably the fact that he stepped up and took it and ran with it the way he did is incredible, because that was before we even thought about touching a tooth. How do we get this thing organizationally sound? How do we assemble a team? Who do we find? Who are we going to find to help you run this thing? We want this to be a dental therapist-led clinic. Managing people is right there, the guy with the head pulling. That's the hardest part about any business. I think anybody would agree with that. It's tough, but it's part of it. So this was a gigantic undertaking before we even touched a tooth. Huge. Okay, let's go to the next slide. So Bill and I talked about our collaborative agreement. Every dental therapist needs to have a collaborating dentist to perform treatment, right? I took Dr. Carl Self out for pizza one time, and I asked him about 1 million questions about this whole thing, and I could tell he was kind of excited, but he was kind of, explaining to me like how there's gray areas in dental therapy. There's areas that you just don't, I don't have a good answer for you on that one. I'm thinking, okay, well, we're going to have to figure all this out, the gray areas, but I kind of got a good grasp of general supervision. And again, the way our building's laid out, private practice is on the left, there's a flower shop in the middle, and there's the public health clinics on the right side. It's going to get kind of cold here pretty quick. And it's pretty funny, I bet, watching me run between the private practice carrying a bunch of root canal stuff across the parking lot and down the sidewalk in there. I run into some of my patients that are going in there. Where are you going? I'm like, I'm going over to do a root canal over lunch. They're like, what? Where? I'm like, oh, I'm going over here. Don't worry about it. I'll see you after lunch. But the general supervision of me, partly why we're open Monday, Wednesday, Friday, is because those are the days I'm in Shakopee. I'm in Shakopee Monday, Wednesday, Friday, so that if anything happens, we don't have to turn a patient away because I can't be there to help them with a surgical extraction or to do something that we don't want to turn patients away. Public health is about seeing these people and helping people. But we've talked about, expanding hours and how do we see more people. A lot of these faces in the room we see and they say, oh, you're going to be busy. You're going to be so busy right away. It's a great thing you're doing. And at first I'm thinking, gosh, okay, well, that's great. We want to be busy, but how do we, how do we handle this with the supervision and getting things done? And we'll go into that in just a second. But, like this afternoon, I'm meeting with a dentist to bring on another dentist that could maybe work a half day or, put more time into the clinic. We don't have all the answers. We're trying to figure it out as we go. But our collaborative agreement is pretty straightforward. And there's things that Bill and I stay in constant contact about. There's things that we don't need to talk about that are pretty straightforward. And there's other things that when we say when in doubt, just wait, don't do anything. Call me. I might be in the middle of a root canal over here. Call Missy, send me a text message of a picture, and we'll figure out what we can do. But Leslie's here. She's a help with that, helping coordinate. When in doubt, we don't want to, it goes back to Dr. Wynn. We don't, you know what not to do, right? Don't do that. When in doubt, the collaborator just wait. So that's kind of what we do right now. And we're still kind of evolving a little bit, but we'll go into more in a second. If you go to the next slide, please. So it's kind of dentistry without a dentist for a little while. There could be a day where we could see a bunch of services that the dental therapist does from start to finish, and there may not be any need for me to be in the building at that time. If there's no surgical extractions or tooth extractions or any kind of removable process or endodontics, if it's just fillings and hygiene checks all day, you can see a massive amount of people with a dental therapist, a hygienist, an assistant, and a front desk. Okay? I'm 50 feet away through the flower shop, but I'm 50 feet away. That's good enough for me. That's good enough for me to trust Bill. Okay? We have to trust each other. The collaborative agreement's a blueprint that we work out, but we have to trust each other. So, the hygiene program, how many hygienists are in this room? Okay? How many hygienists need a dentist to tell them how to do what they need to do? You don't need it. You guys are trained. You guys know what you're doing. Let them run. I always said, if you're a hygienist, you don't know what you're doing, then you shouldn't be here. You know what you're doing. I don't need to hold your hand. If you have a question, I'll help you. But you know how to probe, you know how to chart, you know how to do a diagnosis, chart it, write it down. Are you a 6-month prophy patient? Great. Do you need to come back for recall in 3 months? Great. Are you a scaling replaying 1 to 3 teeth? I'll let them run. We don't need to hold hands. You guys are fully qualified to run a soft tissue program, right? We empower people. That's a whole other topic on, could we have a clinic that's just strictly run by hygienists? Maybe that's what we talk about next year. Why not? But the hygiene program is a hygiene program that can run itself. We've got a fantastic hygienist at our clinic. And she knows, she's learned a lot with us, and I don't think we need to go more into that, but like I said, hygienists, you guys, you're as vital cog in the clinical machine as anything. You can't have a clinic without a soft tissue program. So we let them run. Example of a hurdle is, and I talked to Dr. Self about this, I'm like, well, technically, the way I read it, the dental therapist is not supposed to be doing a comprehensive exam. Okay, that's fine. Can we do a limited exam and say we just, we looked at everything but at a limited view, and we call it a limited, and have the hygienist do their soft tissue analysis, and really we put it all together to have a comprehensive view, but we can't send it to the insurance as comprehensive because we're not letting these people do their job. I don't know how those rules and laws work, but we can call it a limited, but we can still get a comprehensive result. We can look at soft tissue with the hygienist. The hygienist collaborates with the dental therapist. Joe Johnson here has periodontal disease and is generalized. We need to get him on this plan. Dental therapist looks at the hard tissue. We got decay here, here, here. Non-restorable teeth in 3, 4, and 15. Those need to come out. We're going to refer those to the dentist who comes in mouth. The dental therapist works with me on a treatment plan to do the fillings, caries control, fill the spaces, removable pros. The patient's been taken care of. The dentist comes in to do the extractions necessary and maybe the removable partial. Why dental therapists can't do removable pros is a whole another lecture. I don't get that one either. But So we run a limited exam, but we're doing a comprehensive service, but in a team effort between the hygienist and the therapist. The same way that a dentist might refer out an extraction in a private practice clinic is the same way we're looking at an extraction within our clinic. I'm at the clinic Mondays. I work through lunch at the community clinic, mainly pulling teeth. I work Wednesday mornings before I start at the private practice, and I work Friday afternoons after I'm done. And I'm getting to the point where I'm having a hard time keeping up. And that's why we're trying to bring on another dentist. As back to who I am, really, I still have to be a private practice dentist to support the clinic the way it is. I can't. I've got a personal life and things and this and that. I can't. I wanted this clinic to run, but I can't have it take away from what I'm doing on that side of things because I can't financially support the clinic the way I am. I got to make it all work. So if we have to piecemeal this whole thing together with other dentists to help with that, that's how we do it to start. Again, I don't have all the answers. We're still working. I'm meeting somebody at 3:30 today. Hopefully she's excited about the opportunity. Okay? Emergency versus primary care. I think anybody in community clinic dentistry understands that emergency care is just something you have to deal with. You have to see emergency patients. A lot of times people ask me, you give them a tricky treatment plan, and I say, well, what would you do, doc? And I say, well, you're asking somebody that holds a tooth in pretty high regard. If I lost a tooth, if I lost number 12, I would be mortified. If I lost number 12, I wouldn't come up and give a presentation because the idea that I'd feel like I'm missing a tooth, I'd be like, yeah, I'd put an implant in there. Okay? Now, there's other people that don't put a tooth in as high value and regard as I do. And that's okay. There's nothing wrong with that. But I kind of lost my train of thought there. The emergency care, primary care. Sorry, I got off track there. We need to see the emergency patients if we want to be a community clinic. What we found is patients, if we can't see them, they're going to bounce to another clinic. They want to get out of pain. I get that. So we want to try and get them. So what happens when they come on a Monday at 4 o'clock? Well, we're going to have to see you on Wednesday morning at 10. That's the best we can do right now. Dental therapists can't take the tooth out unless it's periodontally compromised or it's a primary tooth. So the patient expectations, the patient concerns of emergency and primary care, what's their expectations when they see True North Community Dental Clinic? A lot of them look at it and say, I can go there and get my tooth pulled. I can go out there and get out of pain. That's true, but then when they come in, sometimes they don't know what a dental therapist is, and they don't know what a dental therapist does versus a dentist. I haven't heard one time since we've been working over there, like, oh, not one patient's ever asked, like, well, what can Bill do versus what you can do? I go by Todd in there, he goes by Bill. We're pretty informal. But we don't go around and say, Bill's the dental therapist, I'm the dentist, unless it comes time to extraction. And Bill explains, well, I'm a dental therapist, this tooth needs to be pulled by a dentist, Todd will be here on Wednesday. So the patient expectations of when they walk in the door, that we have to kind of create a culture that they understand that what is the dental therapist role, what they can or can't do. Can they do a filling? Yeah. Can they do a filling same day? Sure. Can we do extraction? Yeah. Can we do extraction same day? Maybe. Maybe not. Same if you walked into a dentist's office that doesn't extract teeth. There's a lot of dentists that don't pull teeth. So it's a referral system within the clinic. Teamwork is vital. We got an awesome team. Unbelievable team, to be honest with you, that makes it all work, but we're still learning a lot of stuff. And then the funny thing is, like, primary dental care. What does Wikipedia say? It doesn't say anything. What is primary dental care? Are we talking day-to-day dental health, like just preventative, just restorative? Primary dental care to me is you're giving people a home. You're giving people a dental home, okay? We'll talk a little bit in a second about breaking the cycle and creating a culture, but that's, to me, what you talk about when you create a community clinic with a vision. I was on Community Dental Care's website at 1 a.m. last night, this morning, And you guys have turned into 5 locations within your websites, and awesome, it's huge, and all the stuff that you do. And I'm thinking like that, what a role model that is. What a vision. And I mean, I was there 10 years ago, and then it was 2 locations. Maplewood just got started when I was there. That was brand new. So kudos to you guys. That's fantastic. They're taking it and running with this stuff. But primary dental care, what we want to offer is we want to offer a dental home for people. Shakopee doesn't have anything like that. We want a place where people can understand, where we create a culture. So let's go to the next slide. How do we do this with this collaborative agreement? We have to use technology. We couldn't do what we're doing right now 15 years ago. 10 years ago, you go to a lecture and people are like, all right, how many offices are using digital dentistry? It's like, who is not? Are you kidding me? Who's dipping films anymore? There's got to be a couple out there, but digital dentistry is kind of becoming the standard, but it allows us to do things. It allows us to to meet the demands of the general supervision requirement, okay? So Log Me In is a program. Anybody ever heard of Log Me In? Yeah, it's kind of cool. Bill set us all up for this. On my phone, he sends me a text. Hey, I got Lorenzo's in the chair. Take a look at tooth number 19. I go into Log Me In. I can go onto the computer screen. I can go to the chart, click the chart. Yep, number 19's got decay to the pulp, periodontically compromised, mobility +3. Can I take it out? Go for it. I'm 50 feet away through the flower shop. Worst case scenario. We had one happen last week, or Wednesday, whatever day that was. Periodontically compromised tooth. Bill's working on that one, getting that out. I'm pulling a few teeth on a young lady. Root tip snaps off. Well, I'm 10 feet away. We walked over, we extracted it, and life goes on. Okay? That guy got seen. He was happy. He got his tooth that was in pain out of his mouth. We're helping people. Log Me In, though, is a good way for me to go in and approve a treatment plan on the chart. I can do it from my phone from my house, but 99% of the time I'm in 50 feet away through the flower shop. I'm seeing patients. I can run back and check my phone about every time in between patients. Yeah, we got this cooking, we got that cooking. Let me know. Approve this treatment plan. Bill and I will meet before work. We'll meet after work. I'll be doing a root canal lookup. I'll see Bill standing there. I'm like, okay, Bill's got a question. I'll pop out. It's a constant communication. Okay? If I could take that flower shop and put it on the other side, that'd save me a lot of walking. Someday, maybe. And then another way to use technology, there's a program that I think, we use it in the private practice called Weave. And we've been racking our brains trying to think about how do we break the culture and how do we eliminate the failure rate and how do we get to people and help understand the importance of maintaining their appointment. And Weave can go into your software and pull the cell phone numbers out and send these people a reminder that you have an appointment tomorrow at 8 a.m. And it's a text reply. We don't have the budget to hire somebody to call everybody and pre-appoint and confirm. We just can't afford it. So technology can be utilized in a way that helps us all get where we got to go. So who do we see? We see Minnesota healthcare patients from the state plans. That's essentially who we see. And then there's a reduced fee schedule for non-covered services. We haven't had anybody walk in, an uninsured person, but we'd be glad to help them. But essentially there's a reason why we see the MHCP patients, and part of it is the dental community if we want to strengthen the role of the dental therapist, we have to get everybody on board, okay? Some of my best friends are dentists in private practice that have never worked in public health, and and that's fine. And not everybody has to, but I think we have to understand each other. We have to understand why things work, how they work. Let's go to the next slide. I think this is probably one of the biggest points I want to make today is how do we create a win-win-win? This is how this position gets strengthened and how do you get dentists on board? Again, I was at the University of Minnesota when this was all coming through, and I remember hearing what do you mean? Why do we need a dental therapist? People get worried when they think they're going to get something taken away from them. I think that's the problem. You see all this stuff, this political warfare we're at in the United States of America, and I think a lot of it stems from the fear of getting something taken away. We have to understand, it's okay, we can give another group of people something and not have it be taken away from you. Just, everybody's got to relax a little bit, right? Relax. Yeah. So it's okay to take care of some people and not have to take away from somebody else. If you take that fear away of losing something, then people will want to work together, right? So we got to get the dentists on board. We got to get the dentists on board that don't have any foot in the water as far as public health, and they have to be supporting. And I know how we can do that. So number one, the first win is for the people on the stay care programs. When they call, they don't get pushed out 8 weeks. We need to create a dental home, not just a place to get a tooth pulled when a tooth hurts. That's fine too, but we got to create a dental home. And we got to break the cycle for these kids so that they understand no matter what house you grow up in, what part of town you live in, getting your teeth cleaned twice a year is something everybody should do, right? So we're creating a dental home by creating a dental clinic that sees people on the MHCP programs. That's a win for the patients. Another clinic to see people is cuts down the wait time for everybody. Number two, if you compete with the private practice dentists, they're not going to like that. They're going to fear that you're taking things away from them. Okay? I have a practice on the other side of the flower shop, right? Don't forget that. Don't forget who I am really. I'm a private practice dentist that dabbles a little bit in both. I don't want to have my private practice suffer because everybody knows that they can walk over to the other clinic and get a crown or a root canal for $500 versus a private practice fee. How does that go over? How does that go over with the other 5 dentists that I could hit a golf ball with from my parking lot? That I will not be their favorite. So we have to have patients on the programs, and then to get a root canal covered at a reduced fee, it's a non-covered service for people who are enrolled in a program. Okay? Now, the uninsured people that walk in, they fit a significant mold of people that we just, as true human beings, we want to have to help them. And everybody needs to be okay with that. But MHCP patients, we can see them, we can do services outside of what's covered at a reduced fee, so we make it affordable. But those patients are not patients that we're competing for at the other private practice level. Does everybody understand what I'm saying? If you take something away from another group, they're going to fight you on it. So I'm saying that as a private practice dentist, let's create a dental therapist that doesn't take that away, doesn't take away from anybody. It's a resource. If you call, I called 4 of the dental offices in Shakopee, and Bill put these flyers together, and we sent them flyers like, hey, when you get 25, 30 calls a week or a month from these people looking for state care programs, send them over here. They're going to, every one of them was like, awesome, great, thanks. You know, that's what they're really saying is that's good. No, we don't have to see them. It is what it is. But it should be a good thing. They should say, okay, now you don't have to drive all the way to Mankato and wait 16 months for cleaning at the open door clinic. You can come, you can drive right down there, right to Shakopee. We've got one in our clinic now, in our community now. So getting the private practice dentist and to understand this is a resource that's taking a burden off them. Some of them see MA patients, some of them don't. Some of them say, well, we're going to see 5%, we're going to see 1%. Send them. And then it keeps us busy. This is for us to make it, we've got to see a lot of patients because the reimbursement rates aren't what they should be, right? Volume. We only have 5 chairs. Really, we have 4.5. We have 1 chair that should be in the Smithsonian. But and the light on there, my gosh, it reminds me of the old Short Circuit movie. We always joke about that, but we can go to the next slide there. So barriers we face, high failure rate. That's pretty common in community dental. I remember when we were out of school, we double book columns sometimes. What happens when everybody shows up? That's when public health becomes an athletic activity. You can't say no. We put you in there. We're going to see you. You might wait a little bit. We'll get you that tooth out. I might numb you up and do 4 fillings and do this, but I'll come back. I'll see you. Technology is expensive. It's digital dentistry is expensive. Technology is awesome, but it's expensive. So it's a barrier. But can we challenge the history of high failure rate? Can we try things? We have to. You have to keep trying. You got to breaking the cycle of having people being okay with a high failure rate is not okay. Is it going to be always going to be there? Sure, but we always got to be trying to do things. Can we try Weave? Can we try a cell phone reminder? Can we have a cancellation policy that we have clearly written up front saying if you miss an appointment, then you're going to be put on a call list? You know, can we work with the people on the county level to stress how important is it for them to show up for their visit? I know there is follow-up with that. That's awesome. Low reimbursement rate. That's an ongoing battle. I know there was some feeling that there was going to be some bigger changes than there was this year. There wasn't. That's okay. We got to deal with what we got to deal with what we got to deal with. But that doesn't mean we can't keep fighting for higher reimbursement. And then just there's limited resources at the government level for this stuff. I get that. Remember, I have a private practice 50 feet on the other side of the flower shop. I get that. I get the whole point of this. So I'm trying to see things and get a perspective from both sides and how do we make it work. Let's go to the next slide, please. Nonprofit versus for-profit. We are a for-profit business. That does not mean we've made a profit. It just means we're structured as a for-profit. I think it's holding us back on some stuff. I think that's the direction that we're going to move. It's just that we haven't been around long enough to get the momentum to do that. How to compete for great team members. You can't expect people to work for nothing. You can't expect really good people to come want to work with you and get paid nothing. Those people are called saints, and there's not a ton of them out there. There's some of them out there. But you gotta pay people. You gotta be able to compete because people they have families to support and they've got things to do. And that's expensive. You get paid $30 on a pro fee. How can I pay a hygienist $35 an hour? I can't. If we were a nonprofit and you had a grant, I don't know how that works yet. I'll be totally honest. I'd love to learn more, but I don't know how that works. And I want to figure out, can we figure out a way to make that work? Patient expectations from previous public health clinics, again, it goes back to, dental therapist-led clinic versus a dentist. Same-day emergency care, we talked about that, how one of the barriers is my time. I don't have all the time in the world. Availability, to be honest with you, I can't remember why I wrote that up there. And then the walk, I talk about the walk. That's the walk between between the flower shop. It's a barrier. I get over there and I got all the root canal stuff. Oh my gosh, I forgot a gutter purchase file. Missy, you got to run over a gutter purchase file. It's stupid, but it's a barrier. Let's go to the next one, please. So what's our goal? Community dental clinic, most of them have the same goals. You're trying to serve the underserved. You're trying to treat the people that don't have a dental home. Breaking the cycle is a huge subcategory within that we need to work on the prevention side. We need to help people create a culture that dentistry should be something everybody gets a right to, gets to be seen for cleanings. And if you have a tooth problem, we can find a home for you that you don't have to wait 18 months for or something like that. We want to be a community resource in Shakopee and the surrounding areas. We want to lead by example. I think, like I said, we don't have all the answers. We're still working a lot of stuff out, but I think we've got a good team in place and we've got good ideas and good goals, but we're always open to new ideas. But the main thing is we've got to strengthen the role of the dental therapist. You got to get the dentists on board. You got to get the dentists on board. And if you create a resource that benefits the dental community, they're going to get behind it. And all the dentists, I know a lot of dentists, and I talk to a lot of dentists about this stuff, and people ask me, how's that community clinic going? I'm like, it's going pretty good, but here's what we're battling, whatever. But they don't understand. Anybody that graduated prior to 2007 doesn't know anything about dental therapy. And I shouldn't say that. Most of them don't. Most of them don't. So we got to do that. So are we creating a new practice model, or are we a product of our situation? Can we sustain what we're doing? I don't know. I'm going to give it everything I got. And I think we can make some changes and tweak things and move to a nonprofit variety of what we're doing, and continue to have a dental therapist-led model where a dentist comes in strictly to do the stuff that the dental therapist can't do. Don't take the food off the plate of the therapist for the dentist. I just put I put an ad on the MDA, and I put an ad on there for a dentist, and I said, we need a dentist that's good with extractions, removable pros, and anterior endodontics. That's all we need them to do. We got somebody that can do great filling work. We got somebody that can, we've got a dental therapist. We don't want to stop and take off, because there's a commitment level to running a practice that's led by a dental therapist. But we need to find somebody that can do the work. So I thought, gosh, what if there's an associate working at some suburban clinic that's getting no extraction experience, or would like to do more root canals and get faster? That'd be a perfect opportunity. Come down and work a half day a week. Come down and work 1 day a month. We'll get you busy. But that's part of what we're learning. We're learning about how we're evolving into that and going from there. But I think right now we're more of a product of our situation that is kind of creating a new practice model. We're getting an identity for ourselves a little bit. Let's go to the next one. Am I going over on time? Should I wrap it up? Okay. Thank God. You should have been doing this to me. Okay, quick. Future plans. I'll go through this quick. Team Smile and Operation Grace. I've done some work with them in the past, and you're seeing kids, at Target Stadium or Target Field or outside the high school. But I say it's like cooking in someone else's kitchen. Okay, I can't do a ton of work on a little mobile dental unit or on a temporary thing. I mean, you can do like one filling on one kid, and then you got a line of 100 going out the door. Bring them to me. We can slam out, 10 times the amount of dentistry if we're cooking in our own kitchen. So we've talked about mobile service in the community. Can we work with the schools to bring the kids to the community clinic? Maybe we can make that work. I don't know. I think we need to make a shift towards a nonprofit status. And then I think time dictates how we evolve. My time, how I can commit to it, new team members, growth, reimbursement rates. But it's all about giving back. The clinic's about giving back 100%. Let's go to the last one. I think there's one more. The big question is, can we sustain? A lot of people have this thing in their brain. There's a wire that's connected that says, what happens if this doesn't work? I don't have that. My family gives me crap all the time, like, what are you doing? I'm like, failure's not an option. We're going to make it work. Okay? We're going to make it work. Can we sustain? Yes. But we're going to have to adapt and evolve, and we're going to have to change. We're going to have to get some help. We're going to have to do things to change, but we can sustain. I think that's all I got. Is that my last one? I talked about that. Let's go on to the last one. So where will we be in 100 years? A lot of people have these plans, and they say, well, where are you going to be tomorrow? Where are you going to be in 1 year, 5 years? All these consultants. Where do you want to be in 20 years? I like to think of it the other way around. In 100 years, everybody in this room will be dead. Gone, ashes, gone. 100 years from now, you will all be dead. But that makes you think about what you do when you're here. You want to make sure you made some impact, right? 25 years from now, where do you guys want to be? I know where I want to be. I want to be retired, but my definition of retirement isn't not doing anything. I want to be financially free to do what I want to do. If I love fixing teeth still, I want to fix teeth as much as I can. I want to give back and do stuff like this. But I got to make decisions today to put us in a position now. I don't want to wait till I can afford to give my time. I want to start doing that stuff now. 5 years, if you think you have a 5-year plan, forget about it. Nobody, 5 years ago, who thought they'd be doing what they're doing? No way. Maybe a few of you guys. I think it's a joke. I think people think if you want to make God laugh, make a plan. That's what they say. 1 year, I think we're going to really push this clinic and make it into something special. And then tomorrow, where are we going to be tomorrow? Tomorrow is Saturday. I do not think about teeth on Saturday or Sunday. But thank you guys. I think I have one more slide. That's my family with the dogs and the cats and the gang. But anybody that ever wants to come down to the community clinic, I'll buy you lunch. There's some fun lunch spots in Shakopee, but it's fun to come check it out and see what's going on. We may end up reconnecting with some of the people in this group for help to figure out where we go. So if we reach out to you, or you guys are more than free to reach out to us, we'd appreciate any help you guys have, any ideas. If you're a dental therapist and you want to come down and check it out, come down and check it out. If you know any dentists that want to help out, do that. So sorry if I was rambling too much. All right, thank you.